Okay, I'm just going to try and talk a bit on the practical aspects of healthcare delivery models, how it has evolved and how the pandemic has accelerated some of that evolution. Let's say, 20 years back when we were building a hospital in Asia, we were thinking of coming up with a quality policy for the hospital, which can resonate with the provider as well as the patient in terms of what is that the provider want to offer and what the patients are going to be expecting out of that provider. And we want to keep it something simple, but at the same time covering the entire ecosystem of healthcare delivery. So we want to keep it as simple as the ABCD of healthcare. So this is what we came up with. So if you look at it from a provider point of view or from a patient point of view, what do they want? So the provider want to assure the best outcome, which is your clinical outcomes, and build seamless operations that processes are seamless, so the patient goes from one point to another seamlessly, and create value. The patient would expect value for the money they are spending in getting that healthcare provision. And of course, the last one is about the experience, which is very important, because sometimes in a healthcare setting, you can't guarantee the outcome, but I'm sure you can always guarantee the experience. That's still within your control to make sure the patient goes through a good experience. Doesn't matter whether you are going for a life-threatening condition or a simple health screening. The experience matters a lot to the patient. So that is a D, which is delight with personalized care. So these fundamentals have not changed 20 years from then. Even if I look at it today across the globe, these fundamentals have not changed at all. But what has changed is how do you deliver that care? The delivery model has evolved over the years. So if you look at the global healthcare trends driven by various factors, whether you look at the demand drivers or the supply gap, so you see many things here, whether it's quality or changing population, the accessibility of healthcare, and of course we will come to the COVID impact later. But changing disease profiles, all these are the demand drivers that kind of contribute to the healthcare delivery. And then on the other side, you have your supply gap, which talks about whether it's private versus public sector, different pricing models, and someone talked about data, so the importance of data in healthcare. And there's another huge challenge of healthcare professional shortage. That's again a supply gap that drives how we want to deliver care. So now, if you look at pre-COVID, what we could see is that the healthcare delivery was very much fragmented. It is still fragmented in many parts of the world. So you had a very fragmented primary care, a nearly non-existent secondary care. In many countries, you go from primary care straight away to tertiary care. There's nothing in between. So that was non-existent. And then the tertiary care or the advanced care was very much hospital-based, very much focused just at the hospital. That means you need to get to a hospital to get care. So that is one of the aspect of how it was before COVID. And when you look at operations, a lot of silos operations. Everybody works independently, not much connectivity there. And they were always isolated pockets of excellence in the healthcare delivery model, but not in a connected way. You look at technology, there was limited use of technology as an enabler to bring accessibility to private healthcare or early detection, or to even address the shortage of healthcare professionals. Technology was not very heavily used. And then the last one is talking about, in many countries, it was public sector versus private sector, not a cooperative or a collaborative approach. So this was how healthcare was and is in many parts of the world. So now, if you look at what has COVID done, is it has really disrupted the demand. It put every healthcare system to a stress test to see who survives and who doesn't survive. So it is really disrupted the demand for healthcare. Government intervention. The many governments have realized that they can't do it alone. Definitely, you need to cooperate and collaborate with the private sector. Supply chain disruption was a huge impact of COVID-19. many things were taken for granted. People really didn't, pay a lot of attention to how a particular consumable or an item gets to your doorstep from the manufacturer. So the supply chain disruption was a huge impact, and of course, the economic implications. So from when you look at the COVID, the opportunities and challenges that has happened is that many things have changed. So increased focus on quality outcomes, care delivery within a system, not just based on just one particular hospital or an infrastructure alone, and increased focus on cost oversight and efficiency and data planning. We talked about that, and partnership models between public and private or with various stakeholders, and the care system that is going to the patient rather than the patient going to the care provider. So that's one of the huge impact of COVID, and an integrated model. So this is the key takeaway from the COVID impact, is that it is not just hospital, it is between the primary care, secondary care, and the hospital, the integrated care delivery model. So the patient is treated at the right level, the right siting of the patient care. Because in COVID, you realize that for many things, you don't really need to go into a hospital. You could get treated outside the hospital. So many systems that survived the COVID impact were those systems where they had actually decentralized the care, but then integrated through technology or other means. So, if you have a dental appointment, you don't really need to go into a hospital to get a dental treatment. You could actually get it done in a dental clinic or an extension of the hospital where you have the dental services outside the hospital, and you couldn't get it treated. But then, so that is decentralizing, but then you integrate it together with technology. So a true hub and spoke model. So that is what COVID has really opened our eyes to. And of course, the most important thing about digital health, we talked a lot about that, how digital health has become an enabler to integrate all these decentralized services, out of hospital services. And digital health can do much more than that. It expands across the entire healthcare delivery system, manage volume and the data, how the patient is being treated, what kind of information you collect through digital health. And the journey starts not when the patient reaches the hospital, even beyond that, when the patients start thinking about healthcare needs, the patient information, digital health plays a lot of part in providing the right information to the patient. And post-operative, post-hospital care, when the patient goes back to their home, how digital health being again enabler to keep them engaged with the healthcare delivery, preventive health, and healthy living rather than illness treatment. So digital health plays a huge part in that. So just to summarize it, if you look at it, what COVID has taught is that no healthcare system has got it right. Nobody is perfect. It's all about strengthening the healthcare system, removing silos, and improving coordination and promoting value to the patient, and increase opportunity for decentralized or out of hospital services and integrating them back with technology to make healthcare accessible, affordable, and appropriate to the patient. And the other huge change which we are seeing in many parts of the world across the globe is increased focus and attention to building trust. Because when you are in a crisis situation, that's when you are most vulnerable, and that's when you look for trust between your provider and your patient and the different stakeholders. So there's a lot of attention on trust through ethical practices. So a lot of attention we see across the globe in many organizations doing that. And of course, the quality of care, how a lot of focus on providing quality accreditations and improving your infection control, and so such things also play a huge part in the from the COVID which we learn.